Ladies and gentlemen, welcome once again to Ibrahim Traore's era. Today's story is one that will make you proud, one that shows what true leadership looks like. Captain Ibrahim Traore has done it again. He has just handed over 500 more mobile hospitals to the Ministry of Health. A few months ago, he gave them 500. Now, another 500 have arrived. That's 1,000 hospitals on wheels, moving across Burkina Faso, bringing life where death once ruled. Each of these vans can handle emergencies, treat the sick, and even deliver babies. They have beds, medicines, machines, and nurses ready to save lives anywhere, anytime. And people are asking, where is he getting all the money to do this? The answer is simple: from Burkina Faso's own gold and natural resources, the same wealth that France used for years. Now, that wealth is finally being used for the Burkinabe people. For decades, health in Burkina Faso was a nightmare. In many rural areas, a sick person had to travel 50 kilometers just to find a hospital. Mothers gave birth on the roadside. Children died from malaria before help could come. Old people suffered alone because the nearest doctor was hours away. That was the sad truth for millions. To make it worse, thousands of young nurses sat at home with no jobs. They studied hard, they trained for years, but there were no hospitals to work in. A whole generation of health workers wasted while people were dying. Then, Traoré stepped in. He said, "If there are no hospitals in the villages, then hospitals will go to the villages. If the people can't reach the doctors will reach the people." And that's how the Mobile Hospital Project was born. A vision that has now changed healthcare forever in Burkina Faso. These are not ordinary vans. They are modern hospitals on wheels, each with everything needed to save lives: medical beds, vaccine storage, diagnostic tools, and emergency equipment. Every community without a hospital now has at least 2 mobile clinics parked nearby, running 24 hours a day. And there's more. 100 emergency vans are always moving, ready to respond to accidents, outbreaks, or emergencies anywhere in the country. Imagine this: a child in a small village gets malaria at night. Before, the family could only pray. Now, they call a local number, and within minutes, a mobile hospital arrives. Doctors treat the child on the spot. For the first time, healthcare is faster than death itself. But Traoré's plan is not just about machines, it's about people. Those unemployed nurses? They now have jobs. Over 5,000 nurses have been hired and deployed across the country. They are proud, wearing their white uniforms, helping mothers, treating children, and saving lives. They are no longer forgotten. They are now heroes. Each van runs on solar power, using the energy of the sun. No fuel problems, no power cuts. They can work day and night, even in the most remote areas. Traoré also built a mobile hospital command center in Ouagadougou. It tracks every van in real time, where it is, who it treats, what emergencies it's responding to. It's a military-level organization applied to public health. And he didn't stop there. Training schools are now being built to prepare nurses, paramedics, and drivers to serve in these mobile hospitals. Everyone involved is trained to save lives. In just weeks after launching, these hospitals have already treated thousands of people. Mothers are giving birth safely inside the vans. Children in rural villages are being vaccinated. Accident victims on highways are being saved before they reach big hospitals. This project is more than medicine. It's justice. Justice for people who were ignored for generations. Let's take a few examples. In Burkina province, women once gave birth at home, often dying without help. Now, the local mobile hospital has delivered over 100 babies safely. They call the van the Womb of Hope. In the Sahel region, where terrorism displaced thousands, 3 mobile hospitals have vaccinated over 25,000 children in weeks. Diseases like measles and cholera are now under control. In Ouagadougou, a town where road accidents used to kill dozens every month, Mobile emergency vans now patrol day and night. Last month, one van treated 14 crash victims. 13 survived. Before, it would have been the opposite. These are not just numbers. They are lives. Fathers, mothers, children, alive today because of this project. This is what leadership looks like. While other leaders beg for aid, Traoré is building hospitals. While others wait for the West, he's using his nation's gold to heal his people. He's showing the world that true power is not in talking, it's in doing. Every village that receives a mobile hospital celebrates. Elders bless the vans, women sing, children follow behind, shouting with joy. These vans are not just vehicles, they are symbols of hope. Burkina Faso, once seen as poor and weak, is now a light of courage for all of Africa. Even under sanctions, even while fighting terrorism, it is building a future with its own hands. These 1,000 mobile hospitals are proof that Africa can rise without waiting for Europe or America. As Traoré said, a people who can heal themselves are a people who can free themselves. And that is exactly what Burkina Faso is doing, healing and freeing itself. This is not charity. This is independence in action. This is history in motion. This is Ibrahim Traoré's era.